I'd like to thank everyone today for attending, and Peter for that splendid overview of the Understanding Society study. Today, I'll be reporting results from our Selectivity of Digital Trace Data paper, focusing on the COVID-19 contact tracing apps carried out underneath or within the Understanding Society study survey. Now, to begin with, I'd like to look at some of the context we find ourselves in when considering digital trace data. That being this particular digitalization of society, and that is the push across various sectors: m-health, e-banking, financial services, hospitality, food services, for instance, and what has become known as the gig economy. And all this digitalization of society has produced a wealth of information, and that has produced an abundance of specifically process-generated data. Things such as social media, interaction and administrative records, to even locational data and geographically linked data and activity trackers that monitor things such as sleep or outdoor activity. And these also connected to healthcare apps such as heart rate or step counters, which we regularly see in and around us. And that brings to light what the use for research might be. Do we use these process-generated data instead of surveys, given how relatively cost-effective they are, cost-efficient, so to speak, compared to surveys, and given the amount of participants we are able to enlist compared to traditional cross-sectional longitudinal surveys? Or do we link these surveys? Do we use them to complement the content that is produced by traditional methods and or confirm what we have in surveys, such that we can look at whether or not reported income matches what is on file and vice versa? Now, the latter implies, of course, and even the former, that we have to pay attention to the errors that are introduced when we start incorporating process-generated data into our survey work and into analysis. Now, this we can recognize that there was an increased impetus to use digitized data and the pandemic bump, so to speak. That digitized tracking was seen as the way forward to curb the pandemic, and that this was put into process since 2020 and 2021 on a gigantic scale. Now, a few things about this pandemic bump, aka, was that it assumed that we had enough of the population that used mobile phones, and specifically smartphones, to detect the proximity of somebody who might be infectious, and that detection was a reasonable approximation to how close a contact was to transmit the disease, and also that the available technology was sufficient to enable this in the time imagined. Now, this also assumed the willingness of the public to use these apps to enable success, in so much as without adhering to the contact tracing app, we would not get the reduction in rates that we had hoped for. And this was premised on the general assumption that the actual adoption and adherence to app uptake would be, I think, in the beginning, it was a 60% adoption, and adherence was sufficient to suppress the pandemic, which we'll show in a second was not necessarily achieved. Now, governments across the world, and here just Europe in particular, invested heavily into track and trace technology. I think in the UK, that investment managed to reach about 100 million by recent estimates, and one defunct app, which in the beginning, I think it was COVID-X app. And this led to a global policy space shift, that governments were now heavily invested into the use of digital technologies to manage public health concerns and to manage public concerns, which may or may not have knock-on effects in the future, depending what is to arise. However, this ran into the rather tedious issue of non-adoption. regardless of the amount of investment put into these apps and the amount of public awareness made, and just the sheer necessity of controlling the pandemic, people still did not engage with these apps, let alone download them or adhere to them after the fact. And this was seen in England. Recently in the paper, a geographic segmentation, if you will, of app uptake. And we can notice here, we see Manchester in the northwest and London in the southeast, where the app uptake was the lowest in the local district, local authorities, given by this paper. Now, the thing that's important to note here is that this geographic distribution is not without its own internal biases when we consider the communities living in those communities, or living in those areas, and what that means for the success of using digital trace data. That is, those who do not opt into the study are not being recorded, and the information we do have would be recorded on a subset. Now, this raises some concerns about the adoption of apps. The first is that we focus or have focused on the total population using the app, not on specific subgroups, such that the assumption is that those who need the app, who we consider vulnerable, will use the apps, and those who also do not necessarily fall into the vulnerable category also use the apps. Another is that we do not take into consideration the motivational patterns. Now, I think we can all recognize that during the pandemic, many people were on one side of the issue or the other in terms of vaccination, but they also came on one side of the issue when it came to downloading apps and inviting government intervention into their lives, such that those with higher values for social responsibility and perhaps a higher tolerance for government intervention were pitted against those, or not pitted, but were contrasted with those who had higher preference for privacy and individual agency, which has a knock-on effect for substitution effects. That is, those who considered social distancing, for instance, as sufficient substitute for using apps, or for whatever mode of behavioral adjustments made during the pandemic to substitute the necessity for uptaking or for taking up the app. And this also merges with a sort of confirmation bias across society, that we hope, in a sense, that the online respondents, those in convenience samples, those who are more likely to go online to do surveys, are indicative of the general population's motivation, which is a pretty significant a jump, that we assume that those who do not use technology would use app, would download an app and use that technology as if they were more likely to use technology in the first place. Now, this brings into a few stages of selection, which we'd like to discuss here on, and which the rest of this presentation is based on. That is that first, in order to be of use, we have to assume that one owns a device capable of operating the app. Second of all, we need to assume that the device is compatible with the app, as most apps were only designed for certain versions of the operating systems. So iOS and Android, for instance, were the top two operating systems that were compatible, and even then we had later versions that were earlier versions were not compatible. So one might download the app, and the third step, which was the really important step, has to take the initiative to find the app and download it and consent to the privacy requirements, and that their OS should be upgraded enough that they can use the app. And then, of course, that they adhere to the app in the final step. Now, fortunate, which I'll show in a bit, those who did download the app tended to use the app at sufficient rates. For our COVID-19 case study. The COVID-19 case study looked at the three apps, excuse me, that were rolled out in the UK, primarily England, Wales, obviously, and Scotland and Northern Ireland. They were launched in autumn of 2020 with compatible smartphones, those being iOS operating systems, and Android, 13.5 and later for iOS, and 6.0 and later for Android. The commonalities between these apps is that all included contact tracing, or the NHS COVID-19 app included additional functions such as information and the ability to book tests. The other two just had contact tracing with no additional features. And excuse me, our primary research questions were looking at how users selected into using the app. That is, what were the selection rates at different stages, as aforementioned in the graph previously, but also which selection biases were introduced at different stages. And finally, what reasons respondents had for not installing the app, given that they had the capacity to do so given a compatible device. Now, this was launched in April 2020. It used the main understanding society sample, and was primarily conducted via web, so COWI, and then a bit of CATI as well for the May and November 2020, which was a parallel survey conducted next to the web survey. We used the November 2020 Wave 6 data, and primarily focus on the COVID test and trace app and smartphone ownership and operating systems as our main variables of analysis for step down. We were able in this study to also be able to use self-reported make and models of the mobile devices. And for those that we could not ascertain with a lookup function inside the survey, we were able to use a user agent string for those who did complete the survey on their mobile devices, of which we gained 160 cases for those for the November study. And then from the January study, we are gained 22 more respondents. All other respondents who we could not identify as compatible or identify as incompatible were coded as incompatible. So at the end, our analysis sample was 12,160 respondents from those who had full completion to the November 2020 Wave 6 survey, excluding 8 Welsh speakers on account that the Welsh language survey had some items in there that were not in the English survey. A further 711 respondents were taken out due to missingness on any of the analysis variables. This analysis accounts for the clustered and stratified sample design of the Understanding Society study and is weighted to account for the non-response to the November 2020 COVID-19 survey. It is also supplemented with main stage items, for instance, ethnicity and income in the main stage studies. Now, for results, we see that the bias, the step down process is, as shown in the previous graph of downloading the app, that this is a crucial step. We see that the sample is cut in nearly half, 43.4 responding that they had downloaded the app, and of those who had a compatible OS system, it was 59%. Of those who did download the app, and we see 82.6% usage of the app, which is not reported on further here in the bias, simply to show that the area that we must watch for is the actual uptake of the app. And whereas usage seems to be not so much synonymous, but highly correlated with once the effort is put into downloading the app. Now, looking at biases for those within the demographic groups, we see that not all demographic groups are participating equally. We see that those aged 45 and lower are participating at much higher rate, are reporting higher usage or ownership of smartphones and therefore compatible OS systems, and that this compatible OS system and smartphone ownership mirrors down the graph here. What is surprising is the large biases for those who downloaded in particular for those of Black, Asian, and mixed and other non-white ethnic groups, that despite their higher ownership and therefore access to smartphones and compatible OSs, we see larger biases, i.e. less downloading of the app for those respondents. And similarly, we see that those with no qualifications and those of higher age groups have much less, have reported much less ownership of smartphones and compatible OSs, and likewise have much lower rates of downloading the app, specifically groups we would expect to benefit from the app given the COVID pandemic. Similarly, in other demographics, we can see that those who are habitual at the very top users of digital technology, this is a composite variable made of 6 variables in the Wave K data, were the highest demographic, ranked the highest among the demographics for ownership and downloading of the COVID-19 apps. Similarly, those living with at least one younger person, 16 years, sorry, this should be 16 years and younger, not 16 years plus, ranked second highest in that group of ownership, next to those frequent users of digital technology. Concerning about this is that the high risk, the clinically high risk and moderately high risk for clinically vulnerable are towards the bottom of this quote unquote league table. We also see that those who are disconnected from digital technologies, while they do have smartphones and they have not necessarily disparate compatible OS systems compared to infrequent users of digital technologies, do tend towards non-downloading or not downloading the apps. And those living with at least one older adult, again, a key demographic group for the COVID app and the pandemic prevention, have very low rates of downloading the app. And these biases can be further represented by taking the bias between the full sample and each condition. So here we have a graph looking at how the biases are cumulative, and at each stage the bias increases. However, that's not generally true for all cases. In some cases, the biases are due to not having a device and go into the other direction, or not having to install the app. But primarily in most cases, the biases tend to compound. So not having a smartphone is less of a smaller bias, and similarly having a compatible OS increases the bias, and downloading the app increases the bias even more. And this is the same. We find this equally so with the second group of demographics. Particularly worrying is that those who are not clinically vulnerable have high rates of bias, and they're most using, even though that they are the least likely to be at risk in this classification. And those who are clinically vulnerable have the highest rates of bias. So these negative values from 0 means that they're less likely to have the app. And these are all significant except for the health status of good. Those who did not install the app, we find that those who were taking precautions, including not going out or having another family member having the app, were the highest for that was the highest reason for them not downloading the app, therefore contributing to the substitution effect. That is, alternative modes of prevention substitute the motivation to download the app. Also, we see that concerns about privacy and trust in government or the company providing the app also impact on people's desire to download the app and to adopt and to adhere to it, particularly mistrusting the information and app reliability, but also the government. Taken together, this puts trust as the highest reason, most common reason, I should say, for not downloading the app, with substitution reasons closely following that. The least concern was not wanting to use the Bluetooth or GPS for data allowance or using it at work. What we can draw from these conclusions is that when we look at digital data, we have to understand that it is selective, that it is not that adoption and adherence is uniform across demographics, and this should be taken into account when relying on digital trace data for making assumptions and analysis, that these exclusions are often by design in the case where compatible OSs are not available for all participants, but also by capacity, that those who lack the technical know-how, who's a lower digital affinity, are also less likely to download the app and use the app. And also motivation, those with lower levels of trust in the government or the company, or those who have substitution motivations, that they feel that they've already taken things into consideration, do not adopt or adhere to the app. And this is the biases and the subsets I was noting earlier. Particularly interesting is the digital affinity and engagement. And by this, we mean the composite variable, which measures how often users use one of 6 digital technology measures. And this calls into question the fitness for use of digital trace data in surveys. How we approach the use of the trace data depends largely on the research questions under investigation, especially for topics about receptivity to technology. For instance, technology adopters and users may not approximate to the general population, and how we answer these questions are a function of the caveats built into the data generation process. And this can lead to biased conclusions about not just the rates of adoption and adherence, but also any factors that are attached to those processes. And one of the points that should be mentioned here that comes out in the research is that for using digital trace data, and as we incorporate this, if we incorporate this into survey methods and work, it's useful to consider using, as has been mentioned previously in other works, a sort of total error framework, that we should look at each stage of the survey process using digital technology and using that data, and where users can be excluded either by design or by motivation, and how we can tackle that in survey work is important. And finally, it's important to mention a more broader aspect of this, that it's important as survey researchers and anyone who's looking into using digital trace data to investigate whether or not the technology that is being used to generate the data is user-centric and of socio-technical app value, that is, and by that I mean, is designed with a user in mind to make their burden of participation easier. As other work has shown, when the burden is too high or there's too many activities involved, we can lose a lot of data by respondents just simply tuning out. And this is a lot to do with taking into account the nature of the device and the software that it's integrated on. A lot of work is put into survey design and testing, but the world of app and digital trace data and interaction and gathering takes for granted the rather unobtrusiveness and objectivity of technology. Technology is not unobtrusive if we take in consideration the user of where, for instance, an accelerometer is placed on the body, we are able to get better results and more reliable data. It's also important to be careful not to assume away the rationale for non-use. It's not the case that technophobes are against using technology, but that privacy concerns, and particularly among well-educated communities, subcommunities, trump public welfare concerns. And this is something that should also be taken into consideration when we look at how to combine this data. That's it for now. I welcome any questions, and thank you very much for your time.